Good day, class. In the previous videos, we have studied the functions of acupuncture and Moxibustion. We knew that there are three functions of acupuncture and Moxibustion. The first function is to unblock the meridian. The second is the tonifying antipathogenic qi and reducing the pathogenic qi. But how to achieve these purposes? There are three aspects you can think about: manipulation method, treatment method, the nature of acupoints. For example, the manipulation method, you can choose reinforcing or reducing methods. In the needling techniques we have studied, you can use the twisting. In the twisting, we have different techniques, either reinforcing or reducing. We can use the reinforcing and reducing that links to the breathing. We also can use the reinforcing and reducing as according to how you insert and how you withdraw the needles, either to cover the hole or leave the hole open. These are reducing and reinforcing. You also can think about the lifting and thrusting. You also can apply the comprehensive manipulation techniques, either to tonify or reducing. So these aspects are something you can think about. The treatment methods. You can choose, depends on the condition. You can choose acupuncture. You can choose acupuncture with filiform needles. You can choose Moxibustion. You can choose the combination of acupuncture and Moxibustion. You can choose the cupping. You can choose scraping. You can choose 3-edge needles. How to use, or what's the function of the 3-edge needles? You're going to prick to cause bleeding, such as the image on the right side showing you. For the Jing well points, you're going to use the 3-edge needle to prick the Jing points to cause bleeding. These can help you to eliminate the pathogens, to reduce the heat of the body. These are all eliminating methods. So the treatment methods you can think about, as well as the nature of acupoints. You can choose some acupuncture points that focus on tonifying. For example, the 12 Jing well points, the Renzong, Weizong, brother 40, the large intestine 11. These are more focusing on reducing. There are also some points have two directions of both reinforcing and reducing, such as the stomach 36, liver 2, large intestine 4, spleen 6, pericardium 6. All these points have both functions of reinforcing and reducing. So these are some examples. The treatment methods. Different treatment methods we can use depends on the condition, either excess or deficiency. You can use acupuncture or Moxibustion. You also can use the 3-edge needles to prick for bleeding. Especially for the prick for bleeding, you can use for acute condition, emergency, excess heat. Excess heat including the fever, but not limited to the fever, such as the sunstroke. In the diagnostics, we have introduced the sunstroke, the damp heat. That's also excess heat syndrome. We can use the prick to cause bleeding. The acute condition, such as the acute stomach ache, the inflammation, the acute appendicitis, the emergency, such as vomiting, or acute condition, the acute stroke, the stroke in the acute stage. This stroke can either be ischemic or bleeding. So this emergency we can use. We also can apply acupuncture treatments. Depends. We're going to use different technique. For example, a patient suffers from excess bleeding in the vagina. In this situation, if it be diagnosed as Qi and blood deficiency, we're going to use Rong 6, Stammer 36, Blood 20. We're going to apply acupuncture, use the reinforcing manipulation. In the meantime, we can add spleen 1, Rong 4, spleen 6. We can use the Moxibustion. Then for this situation, you can see that we're going to choose the points that's more focused on reinforcing to tonify the deficiency. In the meantime, we're going to use the Moxibustion, also can tonify. We're going to use the reinforcing technique from acupuncture. We are going to combine with the Moxibustion. Another patient suffered from high-grade fever, unconsciousness due to exogenous heat, excess heat. We're going to choose do 14, large intestine 4, large intestine 11, do 26. So the Renzong, the one I mentioned previously, is do 26 or 水沟. We're going to use acupuncture with reducing technique. In the meantime, we can prick to cause bleeding on the 十宣 actual points, the 12 Jingwell points, the ear tip, ear lobes. This can help for emergency, for acute condition. Those points we were choosing do 14, large intestine 4, large intestine 11, do 26. These points have the property or the nature of reducing. These points are very different from the points above, especially Rong 6, Rong 4, Stammer 36. These are more focusing on tonifying. So as you can see, these two different patients, it is not because of the symptom. The symptoms are different. It is because the symptoms. This is the Qi deficiency, Qi and blood deficiency. It is a kind of deficiency syndrome, excess heat, excess syndrome. We're going to use reinforcing or tonify. We're going to use reducing. We can combine with the Moxibustion. We can combine with the 3-edge needle. Jingwell points also can help to reduce. So as you can see, the treatments, what kind of treatments you're going to use, it depends on the syndrome. The nature of the points we already discussed a little bit. Rong 6, Rong 4, do 4, bladder 43, bladder 23. These are more focusing on tonifying, eliminating. Pericardium 3, large intestine 40, bladder 40, do 26. Actual points, 十宣. 12井, 12井 is the 12 Jingwell points. So you either the first point of the meridian or the last point of the meridian. And some points have two different functions, both tonifying and eliminating. Rong 12, Zone 1, pericardium 6, spleen 6, large intestine 4, liver 3, stomach 36. These points are some points that you are going to memorize. In future, you can choose. These are the foundation of your treatments. A patient suffers from cough. A patient suffers from poor appetite or frequent urination. When you diagnose as lung deficiency, stomach deficiency, or kidney deficiency, no matter which organ, you can choose the points that are specific for that situation. For example, a lung deficiency, you can choose the yuan source point of the lung. You can choose the backthrough points of the lung. In the meantime, you can always add this group of points to your prescription. You don't have to, but you always can add. That's because these points can tonify. For an excess syndrome, you always can use these points to help you to reduce the pathogens. The back through points we have mentioned previously, more focusing on tonifying. For chronic deficient condition, C-clef, a lung point, the front mu points and the lung points are exactly the same. The lower C points, focusing on eliminating, can be used for emergency, for acute condition. Doesn't have to be acute pain, acute condition, especially the C-clef points. Because when the meridian, the qi and blood circulation, when they flow to the cleft, the flow becomes much quicker. It can be used for emergency. The yuan source points can be used for tonifying and eliminating acute, emergency, deficiency, and excess syndromes. So it can be widely used in different type of syndromes. The last function of acupuncture and moxibustion is regulating yin and yang. Yin Shu, it described that the key purpose of using acupuncture is to regulate yin and yang. When you see this clause, you will understand that how important it is to regulate yin and yang, especially for acupuncture and moxibustion treatment. We also describe in 黄帝内经素问, it says that in order to regulate the qi, we have to clearly identify the yin and yang. Because we're going to identify the yin and yang, and then for yang excess, we're going to reduce the yang. For yin excess, we're going to reduce the yin. In order to perform the treatments, we need to identify clearly the yin and yang. The application of yin and yang is not as simple as the yin and yang directly, which means if yin excess, you're going to tonify yang. Yin excess, you're going to reduce yin, or the yang excess, you're going to reduce yang. The more advanced technique of applying yin and yang, we're going to treat yin from yang, we're going to choose yang, we're going to treat yang from yin. What that means, for example, a patient suffers from hyperactive liver yang. So as we mentioned previously, the hyperactive liver yang we refers to the deficiency heat from the liver. So we try to identify the liver fire and the deficiency heat. The patient presents as hyperactive liver yang. The patient may present as headache, blurred vision, due to the hyperactive liver yang. In the treatments, we're going to use kidney 3 or other kidney points on the kidney. We're going to tonify the kidney. As you can see here, in this treatment, the patient suffers from liver yang. It's the diseases of Yang category. However, in the treatments, we're going to treat the Yin, the kidney 3, the kidney meridian is the foot, Shao Yin meridian. Yang, we're going to treat Yin. Another patient suffers from Yang depleted. As we mentioned previously, the Yang depleted is a very severe situation. That's why we don't use for spontaneous sweating. We only use for severe condition. The Yang depleted, the patient will present as sweating as well as the cold extremities. Cold extremities, the sweating, that's the Yin disease, especially the cold condition, that's in the category of Yin. Because of the Yang depleted, we can use Moxibustion. We can use Moxibustion on the round 6, round 4. Yang depleted will be accompanied by Yin depleted. So in this situation, we're going to treat the Yin to assist the Yang. Round 6 and round 4 are on the round meridian. The round meridian in the front part of our body, the round meridian, also the C of the Yin meridian. As you can see here, we're going to focus on the Yin meridian to treat the Yang depleted. We're going to treat the Yang from Yin. So these are some examples of the application of Yin and Yang. According to the Yin and Yang nature, Zang organs, we can use the backstool points. The lung, we can use the bladder 13. The kidney, we can use the bladder 23. For organs, we can use alarm points. Stomachache, diarrhea, round 12. Deeper urination, round 3. Sometimes you will see, previously we said the Zang organs, the Zangfu organs, the deficiency, we can use backstool points, back transporting points. The excess syndrome, we can use front move points, the alarm points. But now here why you said Zang organs and Fu organs? What's the difference from the deficiency of Zangfu organs and excess of Zangfu organs? Why we use Zang organs directly or Fu organs directly? The reason is because from the theory, Zang organs, most Zang organs problem are deficiency. So we don't say 100%, but most of the Zang organs, the condition are deficiency. Most of the Fu organ condition are excess. So this are related to the Zangfu function, the characteristics of Zangfu organs, because the Zang organs, the function of the Zang organs need to store, should not discharge. The function of Fu organs need to discharge, the Fu organs should not store. If the Fu organs store something, it becomes excess. For example, if the stomach store the food, doesn't want to move the food downwards to the intestine, the patient suffers from poor appetite, stomach ache, and poor digestive function. If the intestine doesn't want to move the food in the intestine, the patient suffers from abdominal pain, constipation. So these are the excess syndrome. That's why we use the Fu organs directly. These are not the rules. You can use as a references, but sometimes it depends on the patient. You also may change. So this is just an example. Because Zang organs are more likely to have deficiency. Full organs are more likely to have excess. Back two points, lung points. So from the discussion, you will also understand what's the difference between the back two points and the front mu points or the lung points. According to the Zangfu organs or the meridians, these are the examples of one of the examples of how to choose acupoints. In the Yin meridian, the liver meridian, the liver disease, we can use points on the gallbladder. The problem related to the spleen, we can use the points on the stomach meridian. Disease in the Yang meridian, we can use in the Yin meridian. Similarly, the problem on the gallbladder, we can use the points on the liver. Stomach, we can use spleen. The reason is because these are coupled meridian and the coupled organs. They may affect each other. They also may benefit each other. So this is something you can think about in your treatments. In this video, we have studied the last function of the acupuncture and Moxibustion treatments, which is the regulating yin and yang. This is also the purpose of acupuncture treatments, regulate the yin and yang. We have used some examples to illustrate how to regulate yin and yang. In future, when we study specific diseases, we will discuss more on regulating yin and yang, why we use these 2 points for specific disease. Why for some points we use reinforcing, some we use reducing. Apart from remembering the treatments, the prescriptions, we also need to understand the philosophy or the explanation behind the prescriptions. We have to say that apart from these aspects, these factors, such as the function of the points, the manipulation methods, the skills of the practitioners. That's why you need to train very hard. You need to locate the points correctly. You need to identify the meridian correctly. If you insert the needle on the wrong points, then obviously you won't get the good results. So that's also related to the practitioner's skill. Apart from these results of acupuncture treatments, also the patient's body constitution, the frequency of the treatments, the dosage or the duration of the treatments. All these are very important towards the efficacy of your treatments. This is very similar to the conventional medicine. Patients suffer from hypertension. You need to take the tablets to control your blood pressure. You need to take, it depends on the different type of tablets. Some you're going to take 3 times a day. Some, it depends on the different tablets and different technique when they manufacture the tablets. Some you can use once a day, but the frequency of the administration and the dosage is very important. When it described as once a day, you have to take once a day. Every morning, the first thing when you get up, take the tablets. For acupuncture treatment is very similar. For some situation, the dosage, the frequency is very important. For example, for the rhinitis, everyone says this, the acupuncture is very good. It's very useful for rhinitis. But why? When the patient comes to you, you don't see very good results. Sometimes it's because of the frequency. The most ideal treatments, especially for severe condition, it might be 4 times a day. You apply 4 times a day. It's not once a week or once in 2 weeks. So the frequency is very important. Some diseases we're going to treat once a day, some we're going to treat twice a day, some we're going to treat every second day. It all depends on the condition, but we cannot treat the patient. We cannot set a standard. We're only going to see the patient once a week. All depends on the condition. For example, the acute situation, such as stroke, especially in the acute stage or the recovering stage, especially before 3 months, we're going to see the patient every day. The patient will have the best results. Or the Bell's palsy. Bell's palsy is the facial disorder. This situation, if the patient comes to you within 1 month, or even especially if the patient comes to you within a few days or a week or two, you have to advise the patient to have the treatment every day, because at this stage you will gain the best results. If you suggest the patient to have the treatment once a week or even once in 2 weeks, you're going to waste the time, you're going to waste the patient's money, and you're going to receive very bad results, or not as good as it's supposed to be. You still may see some improvements, but you're actually losing the chance of a recovery. So it will all depends on the condition. In the next video, we are going to talk about the principles of the acupuncture treatments. Thank you for your attention.